Hello and welcome to lyranara.me and lyranara.com, and today's video is gonna be all about Lyme disease, and we're gonna show you how you get infected, all of the symptoms that you have to pay attention to, all the tests that you must perform in order to determine whether you have Lyme disease or any other condition, because as you will see, it's not that easy. And we're going to concentrate mostly on a total treatment concept that is based on all natural remedies and integrative therapy devices, and that really works. But before we show you all of that, I would like to mention some words of caution. The therapy of Lyme disease, being such a complex condition, as you will see in this presentation, doesn't happen overnight. It takes between 6 to 24 months, depending on the stage of the disease and your general health condition. And the success of the treatment depends really on sticking with the treatment concept that we're going to present to you precisely, and not mixing it with other approaches, other medications, etc. So without further ado, let's learn more about Lyme disease and especially how to treat it successfully. So let's kick this off by talking about what Lyme disease actually is. It is the underlying cause for many debilitating conditions such as diabetes, insulin resistance, cancer, MS, dementia, autism, arthritis, cardiovascular conditions, and many, many more. It is very difficult to correctly diagnose and treat Lyme disease, and this was the starting point for the research that we're going to present to you in this video. Lyme disease is triggered by a type of bacteria that is associated with micro-parasites called protozoa that are passed through tick bites and possibly other insect bites. Deer ticks and blackleg ticks carry the bacterium called Borrelia Burgdorferi, and those are the two types of insects that many consider are responsible for spreading Lyme disease. Experts also suspect that certain spiders, fleas, and mosquitoes could also potentially carry and spread the disease, and even birds that are eating infected insects are spreading the Borrelia. You can also get sick when you exchange fluids with your partner or during the pregnancy when the mother is infected with this. Let's dive a little deeper into the history of this strange bacteria called Borrelia Burgdorferi. In 1975, a mysterious illness causing arthritis in children showed up in a city called Lyme that is located in Connecticut and in adjacent communities thereof. The new illness was found to be associated with tick bites, and in 1981 a researcher named Dr. Willy Burgdorfer and his colleagues isolated the Borrelia bacteria, which is a corkscrew-like organism, and named it Borrelia Burgdorferi. Dr. Burgdorfer noticed that symptoms of this new illness were very similar to a tick-borne condition that was long recognized in Europe and was called erythema migrans, named for the associated rash that was migrating from the tick bite, as you can see also in the pictures on the right. Physicians then in both North America and Europe have long recorded an illness that is associated with a migrating rash surrounding tick bites. They have done this for over 100 years, but because they lacked the effective treatment options and because the illness was debilitating but not life-threatening, tick-borne illnesses never received much attention. Lyme disease is not a panic-inducing epidemic like, for example, the Ebola virus, but the Borrelia Burgdorferi is a stealth microbe that insidiously makes people chronically and miserably ill, often for a lifetime. It rarely kills directly. Its sole purpose is actually to complete a life cycle stage within its host and then hop on board to the next tick that comes along. Within its natural host, the white-footed mouse, it completes this life cycle with seemingly little harm to the host. In us humans, however, it can be totally different, unfortunately. And there is a real Lyme epidemic going on in the US and parts of the world. But because Lyme disease is so hard to diagnose, no organization has any idea or how many people are infected worldwide. The CDC, for example, says that Lyme disease is the fastest growing vector-borne infectious disease in the US. They estimate that 300,000 people are infected by this disease yearly, 10 times more than previously reported, with 25,000 new cases every month. And the real infection rate, they say, might be even higher. Most people know Lyme disease as an infection that is caused by deer ticks, as we have discussed, and while that may be true, there is much more to the story. Not all ticks are infected, and not everyone who gets bitten by a tick carrying the bacteria that causes the Lyme disease will react in the same way. Research shows that tick infection rates vary from 0 to 70% even within the same region. Beyond that, patients experience a wide range of symptoms once infected, and this means that individual responses play a very important role in preventing and managing Lyme disease. Add to that the fact that the standard test available to screen for the disease misses up to 50% of the cases. It's easy then to see why Lyme disease is such a complicated topic. And the Borrelia bacteria, they belong to what is called Spirochetes Borrelia family of bacteria. Spirochetes are 8 genera with over 100 different species in this genera. Other famous spirochetes are, for example, Treponema pallidum and Leptospira. Borrelia is the genus and Burgdorferi is the species. So Borrelia Burgdorferi includes also Borrelia afzelii, Borrelia garini, Borrelia lonstari, Borrelia andersoni, as well as Borrelia miyamotoi, and many other. In Europe, there are 5 strains, and in Japan, 61 strains have been identified so far. Very important observation is also that all microbes, such as the Borrelia, exchange DNA constantly with each other via plasmids, and you can find Borrelia burgdorferi with properties usually found in Babesia or Mycoplasma. Thus, there are no boundaries between many of these microbes. Okay, and now that we understand a little bit more about what causes Lyme disease, let's look at the early stage symptoms. A characteristic butterfly skin rash that appears where the tick bite has occurred, also called an erythema migrans, it will be noticed. You see this in the pictures on the right. Many develop also a rash shaped like a bullseye that appears as a red ring around a clear area with a red center. And this is considered characteristic of Lyme disease, but often the Lyme disease actually doesn't develop in each patient. In some cases, other rashes appear instead. Some even resemble a spider bite. A recent CDC report on Lyme disease found that about 70% of those infected show a visible rash, while other studies show the range to be between 30 to 80%. You might notice flu-like symptoms, especially shortly after being infected, and these include fever, trouble sleeping, neck pain, fatigue, chills, sweats, as well as muscle aches. Also poor sleep, chronic fatigue and lethargy, digestive issues including nausea and loss of appetite, achy joints and joint pain in general. The CDC found out that about 30% of all Lyme patients develop symptoms of arthritis long term, and maybe people experience mood changes also, including depression and anxiety. Cognitive changes are also a long-term symptom and include forgetfulness, headaches, brain fog, misplacing things, and trouble concentrating. And you might also notice heart palpitations as well as heart arrhythmia. And here you see a complete list of the symptoms of the Lyme disease when it becomes chronic. And in general, the Borrelia has a preference for the central nervous system, the urinary tract, the heart, as well as the connective tissue. And here you see, therefore, that most of the symptoms are within those areas. For example, chronic infections, chronic fatigue, chronic pain, migrating arthritis or joint pain, muscle pain, chronic flu-like symptoms, headaches, neck stiffness and creaking, Bell's palsy, brain fog or loss of cognitive function, heightened sensitivity and agitation to noise and sound, ringing in the ears, sleep disorders or trouble sleeping, visual changes or blurry vision, floaters in your vision and eye discomfort in general, dizziness and instability, muscle twitching, paresthesia, so there's a burning or tingling in your feet and hands, tremors, so for your head and hands, chest pain, irregular heartbeats, shortness of breath or difficulty catching your breath, unstable bladder, as well as gastrointestinal or digestive dysfunctions. And with that being said, we arrive at a big issue with Lyme disease, namely that it often comes with a lot of other co-infections, such as other Borrelia strains, Babesia, Bartonella, Ehrlichia, Coxiella, Mycoplasma, Anaplasma, FL 1953, Microfilaria, Chlamydia, etc. And on top of that, some other opportunistic infections jump on top of it, like Giardia and amoebas, worms, the most common one being the lungworm, Clapovi, helminth worms and other protozoa, but also fungi infections, mold and yeast infections, Candida, Aspergillus, Penicillium, Gladisporium, also all human pathogenic viruses, the most common ones being the Borna virus, HSV1 as well as HSV2, CMV, Coxsackie, human virus and XMRV, but also with strep and oral bacteria, so chronic tonsillitis, and bacteria such as Leptospira, Treponema and Ochrabactrum anthropic. And that makes Lyme disease not only difficult to diagnose but also extremely complex to treat. Another problem in diagnosing and treating Lyme disease is that it often mimics other conditions. So each person's reaction to Lyme disease is different depending on the state of their current health and the strength of their immune system. And there are thousands of people actually living who have been bitten by vectors capable of causing Lyme disease, yet they show absolutely no symptoms. And someone may be more susceptible to experiencing severe symptoms of Lyme disease if they have weakened immunity, inhibited cellular function and protection. They are suffering from environmental stressors, including exposure to mold and parasites. And it mimics other diseases such as lupus, hypothyroidism, depression, chronic fatigue, fibromyalgia, anxiety and panic, rheumatoid arthritis, schizoaffective disorders, MS, ALS, Alzheimer's, Parkinson's, polymyalgia rheumatica, Addison's disease, bipolar disorder, CFIDS, myelopathy, polyneuropathy, brain tumors, encephalopathy, neuritis, depression and anxiety, anorexia, dementia, and many other conditions. Some of these patients do not test positive for having an active infection, which leads some experts to question whether or not Lyme is truly the cause of the ongoing symptoms also. And other experts believe that Lyme causes complications when the body starts attacking itself, which is a characteristic, of course, of an autoimmune disorder. Cofactors that make Lyme disease symptomatic are emotional stress and or trauma, mold and EMF exposure at home and work, unhealed emotional and ancestral traumas, food allergies, heavy metals toxicity, poor sleep and unhealthy nutrition, poor genetics and spirochetes miasmas, as well as jawbone cavitations. Okay, so now that we've understood why Lyme disease is so difficult to diagnose because of the many co-infections it comes with, because of the fact that it mimics other diseases and their symptoms, let's have a look at some tests that you can perform in order to determine whether you are really suffering from Lyme disease. And we must perform, of course, a very complex set of tests, and we will start with asking the patients about their symptoms and their history. We will check also the neurological and general physical state of the patient, of course. We can then perform direct microscopy, for example at Fry Labs, as well as flow cytometry. We can detect the antibodies using the so-called Eliza test, but also the Western blot test, LTT ELISpot test, IgG and IgM measurements. We can also perform the so-called CD57 test. We can also look at lymphocytes proliferation with the Eliza test. We can also have a culture at advanced labs. Dr. Burascano does this, or an ART Klinkhardt test, but also we can perform indirect tests called FACT for different lab parameters. And some remarks about some of the most common tests. The standard Eliza test, also called EIA test, is missing at least 35% of all Lyme cases, unfortunately. Regarding the PCR test, specifically for the Borrelia DNA in the host's blood, because the microbe clears from the blood very quickly, the value of the PCR testing is limited. Only about half of the individuals with Lyme disease will show a positive test, so the test is not very accurate. PCR tests should be limited, therefore, only to very acute tick bite exposure, but even then, a negative test does not rule out the possibility of a Borrelia infection. Regarding the Western blot test for Lyme disease, it relies on the production of antibodies by the host's immune system for different parts, also called antigens of the bacteria. And the Western blot test may provide a more accurate diagnosis of Lyme disease than most other available tests, but because the Borrelia shares antigens with other bacteria, multiple positive antibodies, also called bands, are required for a true positive test. IgM antibodies show acute Lyme disease, and true positive tests are not that common. There is a company called IgeneX as well that adds extra bands for more accurate testing, but the test is very expensive, unfortunately. The newest technology for testing acute Borrelia infection is the so-called Ceres Nanotrap test by Ceres Nanoscience. This test, performed on a urine sample, captures the outer surface protein from the Borrelia bacteria, and the company claims high specificity for the Borrelia bacteria and high sensitivity for picking up acute infection. At this time, the test is not indicated for diagnosing chronic Lyme disease, however. You can also perform specific tests for micro-parasitic infestations, as described in our video about micro-parasites, and I'm gonna link it, of course, in the description box below for you. If you haven't watched it yet, please do so now. It's very interesting, and we suggest that you start with this kind of test for your diagnosis. So with that being said, we come maybe to the most important and interesting part for you of this presentation, and that is our general integrative therapy concept for treating Lyme disease, naturally of course, and with as little side effects as possible, and no chemicals at all. And of course, we must understand that successful Lyme disease treatment is a very complex procedure, and it must address different levels. We must first detect and resolve the interference fields, so the scars, the jaw infections, and the devitalized teeth. Also chronic localized infections such as the tonsils, the appendix, sinuses, etc. Then we have to take care of the dysfunctional autonomic ganglia. And remove allergenic triggers from the environment, as well as take care of our food allergies. We must remove volatile organic compounds from our environment, also new car smell, for example, where that is caused by phthalates. Newspaper and office printing ink can also cause unwanted reactions, so we will remove those as much as possible, and the work and profession related compounds must be taken care of as well. Then of course we take care of our nutrition and lifestyle. So we try to eliminate sugar, grains, starchy foods, and we practice fasting, or at least intermittent fasting. Then we remove the structural blockages so we optimize the dental occlusion to restore the cranial lymphatic pump, and the craniosacral therapy to improve fluid dynamics in our central nervous system. We also use visceral manipulation to improve organ function. Then we remove the psychological toxins, so the past traumas, the family constellations or work constellations that don't work and create stress and traumas in us, transgenerational issues. And here we apply psychoneurobiology to resolve the conflicts and the severe traumas. It also helps to have regular time in nature, regular massages and walking in nature, also endurance and fitness training, Qigong, Tai Chi or meditation. Then we also have to take care of the detoxification of heavy metals, biotoxins as well, to reduce the toxic burdens and eliminate the immune system and the allergic cellular responses. Then we treat the dysregulated physiology and biochemistry. We eliminate the micro-parasites as a first step in our antimicrobial therapy. We also use immunomodulation to reduce the allergic host responses, and we also apply antimicrobial strategies. So how do you take care of the biotoxins in your system as well as the heavy metals? How you detox properly? Lyme patients show a very heavy metal toxicity, which can be very much aggravated by electromagnetic fields. So we recommend that you only use wired internet, no wireless, no Wi-Fi's. Also, it's great to use the so-called Vita chip. I'm going to post a link in the description box below to the Vita chip on your electronic devices and especially on your cellular phones to shield yourself against this radiation. You can also use the TriMed CGI to clear the electrosmog in your direct environment. I'm going to post a link to the TriMed CGI as well in the description box below for you. And for a correct detox treatment, the first step is to protect your kidneys, which are the most vulnerable organs in your body, by redirecting the toxins to the gastrointestinal tract and circumventing the kidneys therefore. The detox strategy is to have products that penetrate the cell wall, which are therefore nanonized, and the toxin-specific binders to transport the metals to your gastrointestinal tract. Prior to doing anything, remove the intestinal biofilm with 1 tablespoon of green clay, followed by 1 tablespoon of fiber laxative for 6 weeks. What are the remedies that you can use? Well, for detoxing heavy metals, we recommend chlorella, Eclonia cava, green clay, zeolites, microsilica, silicic acid, as well as horsetail tea. Cilantro also works wonders. It triggers the brain release of mercury, lead, aluminum, and it detoxes also pesticides such as Roundup. Curcumin with ginger and black pepper in coconut oil triggers cells to release mercury and lead as well. You can do a chelation therapy with DMSO, EDTA, DMSA, as well as DMPS. Humic and fulvic acid mixed with acai, plums, pomegranate and vitamin C from rosehips works great. Melatonin is a good brain detox product specifically for mercury, and you can mix it with melatonin with propolis extract as well. You can use hyaluronic acid combined with sustus in cannels to break up the biofilms. You should cleanse periodically the gut using colonics. Use also the lymphatic drainage, rhythmic cranial therapy and liver compression. And what's also great is dry skin brushing and warm-cold alternating showers. Now that you've detoxified your organism, you have to take care of your dysregulated physiology and biochemistry. For this, you need to do assessment work via lab tests to correct what is missing and what is too much. So check for the hormone levels, mineral, as well as electrolytes, glutathione, sulfur, etc. It's also great to do some genetic testing to find a minimal bypass nutrition to correct for SNPs or gene deletions and mutations. But in general, we recommend magnesium here because you take it transdermally or via injection in this case, because the magnesium feeds the spirochetes actually. Also, supplementation with copper, zinc, and iron is great. They are used by the macrophages and appear in oxidized form in your hair and serum, giving the wrong appearance of excess. Lyme patients also have insulin resistance and need to go on a strict sugar, starch, grain free diet with intermittent fasting to control the blood sugar. In this case, you can supplement also with berberine and niacin or niacinamide. Lyme patients also have often hypothyroidism and thus must receive a therapy to normalize the T3 and T4 values. Lyme patients also often suffer from sexual hormone disorders, and this can be best balanced with herbs, with the exception of DHEA and progesterone. Also, what Lyme patients are often suffering from are GI disorders or gastrointestinal disorders of different kinds. So you should support the colon cleansing, detox the liver and gallbladder, for example, with milk thistle, Gellum forte, and support the pancreas with pancreatic enzymes as well as the kidney, of course. Also, the immune weakness must be addressed, and here you can supplement with vitamin D3, 50,000 units per day, always together with vitamin K2 or MK7. Other daily supplements that you should add are niacin, L-carnitine, L-taurine, L-arginine, OPC, ubiquinol or CoQ10, EPA and DHA fatty acids, sulfur, also known as SDS, phosphorus as lecithin to support your nervous system, turmeric, oregano oil, which is a great mold and yeast therapy, probiotics such as Vita Biosa with prebiotic, which is inulin, strophantine, which is the greatest support for your cardiovascular system. You can also get this exclusively at lyranara.me, link in the description box below, of course. 5-MTHF to support your brain function, chlorella and spirulina to detox. Also some mushrooms, medicinal mushrooms such as maitake, agaricus and cordyceps to support your cellular debris elimination, and also for parasites and worms detox. Royal jelly works also great, hydrolytic enzymes as well as S-adenosine methionine. And when we talk about treating Lyme disease, we also need to talk about treating a condition that is known as HPU or hemopyrolactamuria. Why? Because over 80% of all Lyme patients have developed this condition, and the term that you also often find in literature is KPU, cryptopyroluria, or also it is called Morph syndrome. HPU disarms the immune system by catastrophic depletion of zinc, manganese, arachidonic acid, histamine, as well as taurine, and these losses are hard to detect with any current technology. The only ways to detect those are bone and CNS biopsies. And you can check out our video about KPU or HPU on YouTube. I'm going to post a link in the description box below as well for your convenience. And we treat HPU, for example, with 1 capsule per day of core, which balances zinc, B6, chromium, biotin, molybdenum, and taurine. Test the KPU before starting with any Lyme disease therapy. You can use an HPU or /KPU urine test to do so. Alkaline phosphatase low is normal here. copper-zinc ration greater than 1 in your hair and urine is an indication. Low omega-6 levels in your red cell membrane and the fatty acid test is an indication. And also white blood cell zinc and red cell copper levels being low. If you treat KPU or HPU first, and the system is therefore restored to normal levels, which takes about 4 to 8 months, the Borrelia and the Bartonella-like organisms, as well as the Babesia, respond to much milder interventions without significant Herxheimer or other side effects. We also have to take care, of course, of our immunomodulation capabilities. So how do we test for those and how do we treat our immune system so that it can perform at its fullest? Dr. Lewis Thomas said that the response of the host makes the disease, not the antigens, microbes or toxins. Dr. Richie Shoemaker said that the role of the toxin or microbes lies in the initiation of the mega-multiplying response of the host system to a given signal. Spirochetes are known to align themselves inside the neuronal axon, according to Dr. A. MacDonald, and also inside the myelin sheath of myelinated nerves, and it's also in the lining of the urinary tract, inside the cells of the heart muscles, and outside the cells in the biofilm communities. The over or underactive immune system attacks the cells and other structures that host the microbes, and this is an autoimmune response which leaves the destructive path behind. The lab markers for overactivity of your immune system are the so-called TGF, beta-1, the C3a, monocytes over 7, IL-1, which is also noticeable by a disturbed sleep pattern, IL-6, so low DOPA, TNF-alpha, antiganglioside antibodies, and the lab markers for underactivity are low WBC as well as low CD57. In this phase of the therapy, you can use homeopathic homocortisones for the Borrelia strains causing the Lyme and for all other co-infections. You can add in the last phase also nosodes to treat the EBV, HHV6, CMV, HSV1 and HSV2. You should also consider autourine therapy, especially for the KPU condition, and to increase the natural killer cells activity when your CD57 is below 100, consider different kinds of chlorella as well. Another part of our therapy approach is using so-called rhizoles. Why? Because ozonides transfer oxygen and change the pathogen's environment into an aerobic one, and which is an adverse milieu for an anaerobic pathogen, and therefore they cannot proliferate anymore. The oils are also surface active and they moisten the intestinal mucous membrane where the parasites, the fungi and the bacteria nests are located. Rhizoles are also acting extra as well as intracellularly, as rhizoles constituents have been found inside as well as outside of the cells. Rhizoles also do not damage the mitochondria, they are not mutagenic, and previously damaged and tumor cells are destroyed as well. There are no adverse pharmacological effects that have been found in cell cultures. Rhizoles and other ozonides have also a similar structure to plant and/or peroxide groups and are therefore compatible and act in the same fashion. Such is the case, for example, with the herbs such as Artemisia annua and its natural derivatives such as Artemisinin, Artemisia vermouth art, Alpinia japonica, Achillea ligustica, as well as Anthemis nobilis. And the great thing about these rhizoles is that they reduce the anaerobic pathogens. So you can reduce the pathogen count with these ozonated plant oils, also called rhizoles. And rhizoles or rhizoles have strong and specific antimicrobial properties, no known adverse long-term effects, and are relatively inexpensive and a pleasure to take. They have been used successfully since 1905. And you can treat parasites, mold, and anaerobes with Rizol gamma. Treat both RNA and DNA viruses with Rizol zeta. When on full dose of gamma and zeta, you can treat Babesia, so CDS here, 15 drops, 1 hour apart, 2 days in a row, once weekly for 4 to 8 weeks. After 2 months on full treatment, you stop or reduce the Rizol gamma and treat the Bartonella with Rizol MY, 20 drops. After 2 months, again, you reduce the dose of Rizol zeta and Rizol MY to 10 drops and treat the spirochetes. Here you add Rizol epsilon and iota, 10 drops each. And always follow up the Rizol therapy with absorbents like chlorella, 20 tablets, chitosan, 1 to 2 caps, or zeolite and charcoal. And so we come to one of the cornerstones of any successful Lyme disease treatment, but not only Lyme disease, any kind of viral infection, microbial infection, etc. And this is vivid artemisinin. It's one from the Artemisia annua, also called wormwood plant, and is the leading herb in Lyme disease therapy. Dr. Yu Tu, Dr. Bill Campbell, and Professor Satoshi Omura received together the Nobel Prize in 2015 for their outstanding work on the use of Artemisia derivatives for the treatment of all parasitic infections and especially malaria. It has been even used for treating cancer successfully, but we have another video that goes more in depth into that. And using a unique technology, we succeeded in preparing an Artemisia extract that is like no other one on the market. It's 25 times more concentrated in Artemisinin than all other products that you can find today on the market. And due to its very concentrated form, it shows a phenomenal bioactivity of over 98%. And it's also alive. That's why we call it vivid artemisinin, and you will see this in the color. It is a greenish vivid color, not brownish like the other extracts, because it contains all flavonoids and all other natural components of the plant, and this all contributes to its fantastic antibacterial and antiparasitic effects that all the other Artemisia extracts do not offer you. The therapy is also very easy to carry out at home, is risk-free. You will see no Herxheimer reaction or side effects. You administer it orally. You need no injections or IVs. And the patients normally report that they feel immediately much better and their health and well-being improves from day to day. And usually after a period of only 6 weeks, the Lyme symptoms almost disappear, and after 6 months, the antibody and other tests for Lyme disease and the co-infections that come with Lyme disease are all back to normal. And while vivid artemisinin is the leading remedy we use in Lyme antimicrobial therapy, we also recommend other products such as the Rizos that we talked about and other supplements for detox and immune system boost that we've presented to you already. And by the way, if you want to purchase the vivid artemisinin, the link is going to be in the description box below as well. Okay, so let's see, how do you use the vivid artemisinin to take care of your Lyme condition? It comes in 25 ml bottles, and you must keep the product refrigerated at all time. The number of bottles necessary to heal Lyme disease depends on your condition, your co-infections, the tissue damages that have occurred already, as well as the stage of the disease. The minimum quantity we recommend is 42 bottles for a 6-week therapy, with a second treatment after 1 to 3 months if you still test positively. The preparation, 125 ml bottle per day, is split into 4 portions, each 6.25 mils of extract, and this is dissolved in distilled or reverse osmosis chilled water. This you must consume immediately to avoid oxidation of the plant extracts, and you can add, for example, coconut water or aloe vera, both of course unsweetened and organically certified. Very important also for a successful therapy is to secure a high level of iron and Hem or ferritin within your system. Usually women must have ferritin close to 200 and men close to 400 nanograms per milliliter of blood. The supplementation also with iron must be continued during the therapy using, for example, Floradix, and this must be taken in the evening before going to bed. Pay attention to have 8 hours between the Floradix and herbs extract intake. Vivid artemisinin again is not like other artemisia extracts out there on the market. It's 25 times more concentrated and has all the bioactive components of the wormwood plant, and therefore it achieves 98% bioactivity. Thus you cannot compare it with all the other products, and our health benefit claims made in this presentation therefore apply only to our Vivid artemisinin extract. And apart from the amazing Vivid artemisinin that will help you a lot, there are some other herbs that we recommend. First up, so-called Smilex glabra, also known as sarsaparilla, indicated to treat leptospirosis, Treponema pallidum, also known as syphilis, liver flukes, Shigella and Salmonella, common to Lyme disease patients actually, leprosy and TB. Lyme endotoxins binding, it's also a great modulator for the immune response, arthritis problems, psoriasis, neuroprotective qualities also, it crosses the brain barrier, it's great for pain relief, it improves liver function, it's great for cervical spondylosis and the reversal of the cognitive impairment that we talked about. The second herb that we recommend is the Andrographis paniculata. It's indicated for rapid excretion over the kidneys. It's anti-spirochetal, protects your heart muscle. It's anti-inflammatory, calming. It's a potent modulator of the mast cells and neutrophils. Enhances liver function, offers significant protection against neurodegeneration of the brain, the spinal cord, CSF. It's a great support therapy also for malaria, leptospirosis, hepatitis B, C, also TB, tonsillitis, pneumonia, herpes viruses, mumps, gum disease, AIDS, cancer and leukemia. Another great herb is red root, very efficient for lymph drainage and antimicrobial effects as well in your lymphatic system. It's also indicated to treat Babesia, Ehrlichia and Anaplasma. Fourth up is Polygonum cuspidatum, also known as Japanese knotweed. It's indicated for leptospirosis therapy, Treponema denticola, Bartonella. It's antiviral, it's good for hepatitis B and C, anti-inflammatory and antimicrobial effects. It protects against microbial endotoxins. It increases microcirculation. It decreases the blood viscosity, lowers your cholesterol and lipids, increases wound healing. It's a great angiogenesis modulator, potent antioxidant. It inhibits prostaglandin E as well as nuclear factor kappa B. It's great for leukemia treatment, psoriasis, positive effects also against Alzheimer, Parkinson's, MS and ALS. It reduces autoimmune reactions in general. It's neuroprotective, increases bone mass. It has anti-aging effects and it stimulates the fibroblast. It's also often used to treat rheumatoid arthritis and leukemia. Fifth up is the so-called rock rose, Cistus incanus, indicated also to break cysts, prevent also tick bites, opens up the biofilms, it's antimicrobial and very healing in general. Stevia rebaudiana is great, whole leaf extract, it's very efficient in eliminating spirochetes, better than any of the antibiotics that you normally get to do so. And some other herbs to consider are astragalus, samento, cumanda, berber, nettle, parsley extract, allicin, dragon's blood, cat's claw, oregano tea, as well as citridiol. Okay, and with all that being said, it's time to wrap it all up and summarize what we've learned today. We've learned that Lyme disease is a serious debilitating health condition. Even though it does not kill you directly, it is the root cause for many other multiple chronic disorders such as cancer, MS, dementia, autism, as well as diabetes and many more, as you've seen. Lyme is actually caused by micro-parasites called protozoas as well as spirochetes of the Borrelia strain. Lyme attracts also different opportunistic co-infections such as EBV viruses, herpes viruses, CMV, co-infections such as Bartonella, Babesia, Ehrlichia, Mycoplasma, Microfilaria, Chlamydia, and fungi infections. Lyme is also showing a multitude of specific symptoms that depend on the stage of the Lyme disease, but mimics also other non-characteristic symptoms. Some symptoms to look out for are general fatigue, loss of memory, cognitive impairment, joint pain, fibromyalgia, poor sleep, hormonal disorders, dysfunction of major organs such as your kidneys, your liver and gallbladder, anxiety and mood swings, and many, many more. But Lyme also mimics other diseases such as lupus, rheumatoid arthritis, schizoaffective disorders, MS, ALS, Alzheimer's, Parkinson's, polymyalgia rheumatica, Addison's disease, bipolar disorders, CFIDS, myelopathy, polyneuropathy, brain tumors, encephalopathy, neuritis, depression, anxiety, anorexia, and dementia, and therefore it is very difficult to diagnose Lyme disease. However, as we've seen, there are different tests that can help us correctly assess and diagnose Lyme disease. We also look at the symptoms, of course, and we need to be very careful and perform a lot of tests to detect the Lyme disease and all of its co-infections. And because of these difficulties in diagnosing Lyme disease properly, we estimate that the number of infected people is heavily underestimated when it comes to Lyme disease. Successful Lyme disease therapy is a complex and life-changing long-term treatment. It can be, however, successfully treated with herbs associated with a multitude of different supplements, immunomodulators, and detoxifiers. And the holy grail of Lyme treatment, in our opinion, is vivid artemisinin that you can purchase exclusively at lyra.me, link in the description box below, of course. A complete cure of Lyme disease and all of its co-infections, as well as a regeneration of the destroyed tissue, takes between 6 weeks and 24 months, depending on the stage of the Lyme disease and the patient's general health condition. So don't expect immediate results. It's a complex condition, as you've seen, and the treatment is complex as well. It takes a while to get rid of all of the causes and not only suppress the symptoms. You can also support your therapy with some home devices, energetical, integrative medicine treatment devices that you can use at home by yourself. One of those is the Veget Balance Galvanic Therapy device that destroys the micro-parasites. Then we also recommend the Geno 62, which is a sound and ultrasound therapy device that comes with a specific Lyme program, and this improves your autoregulation capabilities. Red light and PEMF therapy activates your mitochondria, and we also recommend the Aquatone Professional for detoxing as well as activating your lymphs. Clinical devices, the most helpful one in our opinion is the MRT-503, which is a matrix regeneration therapy device. We have an extra video on this one on our channel if you're interested in details, as well as the Kindling Easy and the Tricombin. And all of those home devices, as well as the clinical devices, Vivid Artemisinin and some of the other supplements and detoxifiers that we've mentioned in the presentation, I'm going to post the links to them in the description box below for your convenience. And with that being said, I hope that you've enjoyed this presentation. If you did so, please do not forget to like, share, and subscribe. We come out with new content every week. And if you need personal advice and consultation on how to treat your particular Lyme disease condition, please do not hesitate to contact us. Contact information also in the description box below, or you can just send us an email at shop@lyranara.com. And until next time, stay healthy.